Hi everyone. I've been working on some minor modifications, technical changes to improve eyelid surgery even further. One of the problems I want to discuss today is about the traditional eyelid surgery. The way traditional eyelid surgery is done is patients typically in the holding room or the preoperative room, sometimes called, the surgeon comes and pinches the skin and marks the incision while the patient is awake just to kind of mark out the incisional types. Okay. And I've been in practice for nearly 16 years now, and I never found that to be a very good method to estimate how much skin needs to be removed because you really don't know exactly how much to take out if you're just guessing. I want to be precise with how much I take out. So what I do, what I've done for a very long time is I actually take the patient to the operating room. So I don't usually mark them in the preoperative room. Once they're lying down with calipers, which are very, very precise measuring tools, I mark out exactly where I want the incision to be. And the reason I do that is because they're traditional landmarks. Like for example, in the West, the lid crease is in a certain distance from the lid margin where the lashes are. Like this is a lid crease right here. So this varies from different populations, and also as people get older, this can retract back into the globe, deep into the globe. In Orientals, they of course don't have that lid crease hardly at all, and in some cases, this lid crease even comes down even further or comes close here like this, and occasionally can look like a little extension to the lower lid. So there's a lot of variations, but the idea that I want to propose here that I've been working on is that in traditional eyelid surgery, what happens is that doctors come in and they basically pinch and mark, and that's what they do, and they go in and just remove some skin on the top and maybe remove a little bit of a sliver of muscle, and they close it up. Occasionally they take out some fat here, maybe some fat here, maybe some fat here. So that's the traditional way of doing it. It's been a standard way of doing it for a very, very long time, but I never really found that to be very satisfying or a good technique for various reasons, because I'm just doing what other people did, and I'm just doing something that is okay but not what I consider to be great. One of the reasons is because in that technique, most of the time, the recreation of the crease ends at the end of the corner of the eye right here, because the idea was if the incision doesn't go out, it doesn't show. But all of us know, right, the popularity of Botox. One of the reasons is we want to treat these crow's feet. And many times, although the corner of the lid ends here, the crease sometimes extends like this and like a swoops over, like it's like a gentle swoop over like that. And this area constantly looks bad on patients. I'm sure you've seen this. And so if you come across here and you don't address this part, although you did eyelid surgery, it will not, to my eye, look good, and then you have to go back and do Botox here to further improve it. And crow's feet, are very prominent lines. A lot of people have, and they're already existing what we call landmarks or lines, pre-existing creases in the face when somebody has this problem. So the genesis of the idea, the variation in the technique are twofold. One is I mark where this crease needs to be in the operating room with calipers, so I know exactly where I want it to be. And then when I get out here, I extend a limb out in a tangential manner to the corner of the eye. When I do that, this extra skin can be also removed, and this incision heals so well in about 3, 4, 6 months. In the meantime, you can cover it up with makeup. You will never have that overhang. The second thing that I do is that when I incise the skin, instead of guessing how much with the pinch technique, which is essentially marking before, I dissect all of this tissue all the way as high as I can go. When I do that, what happens is that it allows me, almost like redraping a bedsheet on a bed and pull it down, it shows me exactly how much skin overhang there is, that goes beyond the crease. So it kind of drapes over the, below that. And if you have that, you can basically mark it and trim it exactly, where the eye is closed, and you can redrape that extra skin and you can trim it exactly the way you want. And so it's much more precise. And when you do that, even in the extension part here, that also shows and hangs like this, which you can trim, and then you can close it off right there. So which also makes the corner that much nicer. There's yet another advantage of doing this technique, because this is what I call a skin muscle flap, basically not just taking skin but skin with the muscle, because if you're removing this tissue here, you're taking out skin and muscle. So there could be a possibility, and I've seen it, where you debulk that extra muscle that causes the wrinkles in the corners called the crow's feet. You may improve the crow's feet just from surgery alone, so that the need for Botox may be different. Another thing that may happen is, because you're debulking the muscle here, which is what causes crow's feet when the eyes close like this, and you debulk it, this becomes weak in relation to the muscle that pulls the brow up. So when you remove and debulk this muscle, the relative force or the relative strength of the muscle that pulls the brow up is higher, because this is now weaker. And therefore the position of the brow also rises nicely, which makes the eye look nice and sharp. Because don't want a brow that draws down, because that's what makes people look sad and whatnot. You want the eyes to kind of have a gentle arc kind of going upward, and that's what gives the very nice almond shaped angled eye that goes in this direction, does not go straight and does not go down. You want the eye angle to be going gently upward like that, and all the lines should mimic that. And so there's a lot of advantages there. Well, there's one other modification to this that I've been working on, and the modification is as follows, and I think there's a very, very good rationale for doing it, and I've been getting very good outcomes with it, and I hope to publish this here, or at least present it here in the near future. Occasionally, I'm going to make sure this is clean. Occasionally, in some young patients who have the capacity, this area here can be very thick. Even if you do a good surgery, a lot of patients can come back and say, "Doc, I still have this thick skin right here." And occasionally, some people, although it fades in 99% of the people and it's not a problem, say that this incision can be visible in some cases, and they can cover it up with makeup, but they just kind of give some feedback. So one variation of this is you could potentially extend it a little bit before the end and basically end the incision within the eyelid area here, so that this gives the opportunity to remove this skin as well, the thicker skin, and also avoid this incision that goes out. Although I prefer that in older patients and male patients and stuff, and I still do that regularly. In some cases, in some younger patients, most of the incision is hidden in the crease, but I kind of extend this limb a little bit inside of the brow here, and maybe it can vary the angle depending on how much extra skin there is. But that gives, again, several fold advantages. One is it removes this thick skin, it avoids this extension that some people may not want, it hides it within the brow, and the shadow of the brow completely hides it even during the healing period. And it for sure improves this area significantly, which again makes people feel like they're heavy there. And the same other principles apply, which is you're debulking that strong muscle, which allows the brow to go up more and makes it much more open. It minimizes the need for Botox here, and the incision heals so well that in about 3, 4, 5, 6 months, it's not visible at all. At the beginning, it may be visible just like any incision is. Even facelift incisions are visible. But in 5, 6 months, it disappears. And if whatever faint hint of something there is, you could either improve it with some skin treatments, with lasers or whatever, or some other skin changes. But truly, with time, it just goes away. And one of the reasons we know this is because we see it every day. In reconstructive cases, there's loss of skin here because of cancer, trauma cases, and lacerations that people get from injuries. All those heal beautifully in that area. And so we have years of experience operating in the higher area of the eyelid, and those incisions heal absolutely beautifully with very, very little evidence of visibility, especially if they are purposefully created, not like a traumatic way, like outdoors or whatnot. But if you precisely create that the way you want it, it heals amazingly well. So this is another variation of eyelid incisions that I think are going to bring much more innovation to this field, because this has been a static technique for 50 years. And I do think there's room for a lot of improvement to improve techniques, and which is what I love to do, is to innovate. And so there's 3 real variations of incisions here that I'm kind of bringing to the fold, which I hope to describe and kind of present and write up at some point in the future. But patients have been very happy, doing very, very well with this incision. And I think, like I said, that this is going to hopefully become the standard of care based on the type of patient you're treating: male, female, older, younger, somebody who wants a sharper look versus somebody who doesn't. So we're giving options to patients. Thank you.